this video, we're going to talk about acute pain. This is all out of the safe pain relief method that we developed at the Pain Relief Foundation. So you can head over to Pain Relief Foundation to see what we are doing. It's PainRelief.foundation if you're interested. So let's get started. We have been talking about pain a lot, and that pain is a signal in your nervous system that something might be wrong. So it's a sensation basically. And as you know, there are two parts of pain. There's the acute pain and the chronic pain. And in this video, we're going to focus on the acute pain. This is, I think, very clear to understand for everybody, but I want to make it very precise. What is the difference between acute pain and chronic pain? So the brain is processing chronic pain differently than acute pain. This is interesting to know. So if we look at the brain in these two images, we see that for chronic pain, there's much more regions involved into the pain than in acute pain. And this may have to do or has to do with a lot of stuff. It could also be stored memories and something like that. So happenings from the past, happenings from your childhood, and so on, because the brain is processing much more information in the case of chronic pain. We will look at acute pain in much more detail now. What is acute pain? What is the definition of acute pain? The general definition of acute pain is that the acute pain lasts for minutes or up to 3 to 6 months. So some doctors or some professionals say it's 3 months, others say 6 months. So we define it just from 3 to 6 months. Most of the time related to soft tissue injury or temporary illness. This is the cause of the acute pain. And very important as well is that the acute pain can evolve into chronic pain. And this can be defined as chronic pain after 3 to 6 months. So if you injure, if you hurt yourself and you still have pain after, let's say, 6 months, then it's typically chronic pain. Because if there is no illness or no tissue damage anymore, it's not, the pain should not be there anymore, so to say. So I have an example here. Imagine you're walking in the wood and it was raining on the day before. So you slip over some wet stone or some wet piece of wood and you hurt your knee. And immediately your body or your brain tells you that you should stop. So you will stop, you will feel some pain in your knee, and you will stop to walk because your brain wants to protect you. And this is actually a good thing, because it could be if you put more pressure, if you put more weight on that knee, that something would structurally happen. So this is how your brain is actually protecting you. So because of the pain, you decide that you try to go back somehow, and luckily you are not far away from your car. So in just 5 minutes you can reach the car. You go back into the car and you are able to go back and drive back, luckily. In the car, your brain goes, how long will that take? I hope it will go away. I have to go to a meeting the day after tomorrow. Will I be able to do that? I want to visit some friends in Boston. Will I be able to do that? So you're starting to worry. And this worrying can cause some kind of loop, so to say, because you're worrying, then your pain maybe gets stronger because you're focusing too much on your pain, and then you feel the pain, and then you're worrying more. So we have to be careful not to get into a loop. But for acute pain, in this case, some days later, the pain is gone. And this is the normal flow, and this is how it should be for acute pain. The acute pain should be there to tell us, okay, now stop, because this could cause actually tissue damage, or say, okay, stop, you should rest now in the case of an illness or something like that. It tells us something. And it's very important for us to realize that the pain is always there to tell us something. So we need to listen, especially in the case of chronic pain. So in this case, the pain went away, and this is how it should be. But if the pain persists for 3 or 6 months and you don't see any injury anymore, there's no damage anymore, there's no illness anymore, it evolved into chronic pain, and then very likely there's some other purpose or some other issue behind the pain, and we need to look in more detail at it. So the facts about every kind of pain is basically that the pain is entirely generated by the brain. Even that the body part seems to feel the pain, this is just sending the sensations. So if you hurt yourself, if you cut yourself, if you burn yourself, this will send sensations that will travel up to your brain, and your brain will try to figure out actually what is going on and try to figure out if this is dangerous or not. And we look in more detail now at the situation, the example situation. Let's say you are waking up in the morning, you go and put the toast into the toaster, then you go off and brush your teeth, and for some reason the toast gets stuck in the toaster, and as you brush your teeth you can smell already that there is something going on and it smells burnt. So you rush back to the kitchen, you see that it's all smoking, and you try to get the toast out of the toaster, and by trying to do that you burn yourself. So you have pain in your finger or in your fingers because of the heat of the toaster, and immediately, of course, your brain is feeling pain. And why is that? And how does it work basically? The way of the pain is that a pain signal is sent to the brain from the finger in this case. The brain receives the signal but needs more information to understand what the cause of the pain is. So how that works, and this works in milliseconds, we can't say first of all it looks at this factor and second of all at this. This goes so fast that it's milliseconds or even faster. So the brain will consider the visual cortex. What am I seeing? What does that mean? So in this case, the brain will get the information that there is some smoke. We see the black toast. We see that we burned our finger. Maybe we also see other stuff, like maybe we see the coffee machine. But for the brain, in this case, it just picks the dangerous signals up. It just tries to evaluate if it could be dangerous. And in this case, we could say the signal from the visual cortex is saying there is danger because of the burnt toast, because of the clear indication there is something going on. The auditory cortex, what I am hearing and what does that mean? So in this case, maybe you still hear the toaster ticking because it was so hot, so it's now cooling off. You can also maybe hear the birds outside or some other noises, but this will not go into the consideration of the brain at this moment. It will look at the ticking, and also this confirms that there could be some danger in this case. Then there's the planning cortex involved. What have I planned for tomorrow or next week or today? So this also is processed by the brain, and it is taken into consideration if there should be pain or not, depending on what your plans are, depending if you're going to do something that you want to do, then probably the pain is not that much, or it could even be that there is something you have to do today or tomorrow that you really don't want to do, and in this case it could actually help to produce more pain. And if you think about that, it's actually very logical. And one of the main or most important things is the past memory cortex. What do I remember about this situation? So this could be a situation you experienced yourself, burning yourself in the past very heavily. This could also be a memory of a family member, a friend, or somebody who got burned heavily, or something seeing on TV or experiencing in your childhood or whenever. So every memory actually adds to the pain, and is one of the most important factors if you will feel pain or not, because the situation will be seen in a specific way if you have the memories according to it. So now the brain has to make a decision. Do I need pain now? And in this case, if we look at the situation of the toaster, the visual cortex said probably there is danger signals because of the black and because of the smoke and because it maybe saw a little mark on your finger. Then also there is the auditory, the toaster was ticking. The past memories confirmed, let's say confirmed in this case because you really burned yourself heavily some time ago and you still remember that. And let's say you don't really want to go to work tomorrow. You have something, have an appointment or whatever tomorrow that you don't really want to do. So in this case, it's very clear that your brain will decide to produce pain now. It could also be very different. It could also be that your visual cortex and the auditory cortex is picking up something, but you go on holiday tomorrow or you have a past experience where you know that you burned yourself, but it was not a big deal. And you can try that out for yourself the next time. If you burn yourself, I do that for myself all the time. If I burn myself, I will just tell myself that this is safe, that I am okay. I will look at my finger and I will let my brain know that yes, it happened, but it's okay. And the pain is not needed. I have it under control. There is no special injury, there is no damage if I look at my finger. This really works very well. This is a very simple strategy, but it works already. So in this case, it is the question, some people will feel pain, other people won't. I hope that was useful, and in the next video we're going to look at chronic pain. Chronic pain is very different from acute pain. It's not different in the way you feel it, but it's different in how it develops and what is behind. So I hope that was useful, and I see you in the next video. All the best. Bye bye. See you.